privilege to be here, and I really thank you guys for coming to this chat today. So we're going to go over a few things about treatment planning, choosing your treatment team, setting goals, and just kind of navigating the very beginning of a diagnosis. The following slides were provided by Pfizer and were updated by Dr. LeBlanc in April of 2020, so all this information is up to date. This was all developed in conjunction with the cancer support community. There was a lot of collaboration going into this to kind of give you guys the best information and the most helpful information possible. I have no financial relationships or affiliation to disclose with Pfizer Oncology. And we'll get started. So the objectives for today, I want to be able to help you guys navigate the beginning steps of a cancer diagnosis and kind of set you up with tools to succeed throughout this entire process. Definitely getting as much information as possible is a good thing. Learning how to build that support system, asking questions and knowing when and what kind of questions to ask. And just making choices that are right for you. You guys are in the driver's seat, and you know, we really want to cater this experience to you. My additional goal is to not overwhelm you today. So I know this can be a lot of information. There's a lot of information flying at you guys from all different angles, and I totally understand that. Sometimes just being exposed to it is good, and you'll hear it once over, and then afterwards you'll say, what exactly were we talking about? Or what did we take away here? So I encourage you, if anything sticks out in your mind, definitely write it down. Don't feel like you have to remember everything or that you have to do absolutely everything in this PowerPoint, because that's certainly not the case. If at any time you guys have any questions, totally feel free to unmute yourself, write in the chat, interrupt me, whatever you need to do, or write them down and ask at the end. Really, whatever you're comfortable with works for me. So some tips right off the bat for a new diagnosis. This does not define you. It's going to change your life. It's going to change everything around you, but this isn't what defines you in its entirety. Educating yourself, getting support, and having that hope and courage, and trying to keep a little bit of normalcy, whether that's watching your favorite show on Wednesday night or having dinner with your family on Thursday, or even, you know, doing a workout video on Monday morning. Just trying to keep some kind of normalcy in your life to say, you know, I am still me. This is just a card I got dealt, and I'm putting it into the deck. So, treatment planning basics. Some topics to discuss with your medical team. When you first meet with your oncologist, again, it all seems overwhelming at first. There's going to be a lot to consider, a lot to think about, a lot to talk about. Before you meet with your oncologist, I think it's best to kind of do just a mindful scan of your body, your life, any kind of events that you want to attend, and kind of the year coming up, you know, your upcoming year, and say, okay, what do I want to accomplish here? Is my quality of life really important to me? Do I have a wedding I want to attend? Do I have a grandkids, you know, graduation, or a birth, or a birthday, a big birthday, or a milestone that you really want to be well for? And just try to survey all those things in the upcoming year and take that into account. Because at the end of the day, you know, these milestones and time with your family or time doing things you enjoy is what we should really plan your treatment around, and plan this diagnosis as much as we can around what's important to you. So of course, logistical things like cost, overall health in general, available resources, things like this are also important things to take into account. Again, this is your experience. Setting your own goals, planning a strategy for those goals, and asking for help if you need it. You know, I think oftentimes in my experience with patients, they'll say, gosh, you know, I'm hoping not to tell anyone about this. I want to keep this a little private, or I need all the support I can get. I have to tell everyone and just kind of reach out. So it's really different for everyone. And just remember, at the end of the day, it is about you. I think oftentimes with a new diagnosis like this, you're going to have a lot of people come out of the woodwork, and it can be a little overwhelming and say, you know, wow, this is it's all coming from a good place, and it's sometimes hard to put down, but if it's too much for you, you know, just remember that this is about you. If the support is overwhelmingly so, you can have that liberty to say, you know, I think I'm good, and just keep your circle small and tell people as you find it appropriate and whatever works for you. You certainly don't have to broadcast any information you're not comfortable with sharing. So this is your experience. So center it around your needs and your goals. So shared decision-making, when you meet with your oncologist for the first time, if you haven't already, it's an ongoing process. So taking your values and goals, which can change over time. They definitely, you know, there's a lot of forks in the road that you might come across that your values and goals start to change or become different, and then in turn changes the direction of your treatment. You are in the driver's seat. So the oncologist's role in this shared decision-making is kind of to lay out all the options for you. And based on your needs and based on your goals, just pick something that works for your lifestyle, for your family, for yourself. And you should always feel like you're contributing to making these decisions, that, you know, your oncologist isn't directing you in one way or the other, rather giving you all the options and giving you all the information possible for you to make that informed decision. So some goals to set, and a good place to start is just to kind of take a look at a few life areas, including your physical, emotional, sexual health, and well-being. So what's most important for you to be able to do? You know, do you want to keep your physical strength, and is exercise really important to you? Or is, you know, being at church on Sunday really important to you? That's going to kind of dictate where your treatment goes in the week, things like that. Family and social relationships, again, childcare, taking care of family members, children, grandchildren, things like this. Working, school, and just home life. Check with your workplace and see what kind of schedules you could swing moving forward and how flexible your time can be. I know everyone's kind of in an odd, flexible time right now with work schedules and things like this. So just kind of get some information from all those aspects of your life and see how can I fit this this treatment into my daily life. Community involvement. So again, things like if you want to be at church every Sunday and that's what's important to you, make sure you can kind of work around that and have that as one of your goals to feel well enough to go and do. Trying to find what brings you joy and keeping that normalcy that I was talking about before, and kind of using that as a goal and seeing what exactly you can do to make sure that you're able to attain that and able to keep that in your life. Milestones like birthdays, weddings, things like this can all be brought up during these first visits. So your values are very important for this goal setting, and again, they will change over time. So here's kind of some other examples of where to start. Being active with your family, want to be healthy enough to attend certain events, whether you want to be super aggressive with treatment and side effects aren't as important to you, you'd rather just tough it out and go through the motions, or you'd rather have few side effects and feel well and kind of take a more conservative approach. These are all things to take into account. Clinical trials, of course, while advancing science, that's one of the perks of being in a clinical trial. It's also, you know, if you're eligible for one, it's a different treatment option, and it may or may not be best for the diagnosis that you have. So things to consider with that. Clinical trials, I know things have changed over time. The treatments for cancer diagnoses are changing day by day. I mean, in the past 5 years, there's been so much change for the better and so many new options and targeted options. So being in a clinical trial can sometimes be considered a first step rather than a last resort. So I think that's something that has changed in the past decade or so. Bozeman Health does offer some clinical trials. We also have an affiliation with Seattle Cancer Center. And that's always something to consider right off the bat too. That's not always the last option. like it has been in the past. So some other tips for the cancer journey, there's a lot of decision points along the way. I'm a planner, so I understand when people come in and say, okay, what are my next 6 months going to look like? I am always happy to map that out with people with the disclosure, things may not go the way we plan. And sometimes it's a matter of when and not if. You know, there's always going to be forks in the road, some really good, some not so favorable. So it's great to have a plan and to have an outline, but just be prepared to deviate from that plan. Taking things one day at a time, one step at a time is a really nice way to kind of process exactly what's going on. So if you come in and you say, you know, your oncologist says, all right, we're going to start treatment and it's going to be 3 1-month cycles, take it one cycle at a time. So just kind of bite off that 28-day period and say, okay, here's my plan for this point. These are the days I'm getting treatment. These are the days I'm getting labs. Here's my appointments. And here's what I'm going to take on at once. So I think taking those little small bites or chunks and kind of just, you know, approaching those in small bits is a really good way to go about it and can kind of decrease some of that stress and that overwhelming feeling. Creating a written treatment plan is a great thing to do. You know, it's like a different language learning oncology, and I'm always just amazed by patients who come in with absolutely no medical background and say, yep, got it. And it's amazing. And everyone learns, and it becomes, you know, second nature once you do it over and over. But it is a lot to digest, and it is a lot of different terminology, a lot of different ideas, concepts to learn. So definitely write everything down. Something I do with my patients at the cancer center is just give a calendar and write in the appointments, the labs, which days you're getting which infusions, things like that, you know, meds to take on the side, what days to take those, and just kind of having that in a month chunk and looking at it and just being able to see what's happening what week can be really helpful. So understanding the diagnosis, again, this is all gonna, you know, it's just a totally different language and it's a lot of new information. So asking your oncologist to tell you exactly what kind of cancer you have and what stage is a good thing to do right off the bat, and just having it written down so you know. This is helpful not only for, you know, your own information, but if there was ever a time where you wanted to look up different treatment options, different clinical trials offered elsewhere, it's good to know what type of cancer you have and what stage. Copies of your lab reports. There's something called MyChart online. If everyone is not already familiar with that, you can sign up for it and you can see all of your lab reports, all of your imaging readouts on this portal. You can also communicate with us in clinic through that portal by using a little messaging system, which is also a really nice feature too. Talking with the nurses. So our infusion center here is wonderful. The nurses are super experienced and can be a really awesome resource. You know, they see this day in and day out. They know how people are feeling throughout treatment. They, you know, have seen a lot of them, have worked at a lot of different institutions. So definitely use your nurses as a resource to kind of bounce ideas off of and you know, go through different contingency plans and things like that, because they can be a really good resource. Online blogs and cancer support community groups, friends of friends, things like this. Go ahead and look at those things. Google, of course, is maybe not your friend to Google certain, you know, treatment things or side effects, but the blogs that exist about, you know, patients with multiple myeloma undergoing treatment, or the support groups in town for prostate cancer or things like this, are a really, really good place to kind of debrief with others who are going through the same thing. And you can get some other firsthand information that way as well. So again, this is kind of what we were talking about before, just really getting familiar with the type, stage of the cancer and what kind of symptoms you'll experience from the disease itself. Symptoms from the cancer are different from symptoms from the treatment. So that's another good thing to understand and kind of ask those questions when you have your appointments. What types of tests will you need? So things like blood work, will you be needing imaging, and what kind of imaging? Is it a CAT scan? Is it an MRI? Is it a PET scan? And just kind of familiarizing yourself with those different types of tests. Second opinions. So Bozeman Health is a community hospital. I say this coming from, I worked at Dana-Farber previously. I worked at University of Vermont Medical Center, and I was so impressed when I moved here of the excellence of the Bozeman Health Cancer Center. It really is a fabulous group with a lot of really smart, well-trained providers and nurses. There are things that a community hospital cannot offer that an academic center can. And really, truly, the only thing is resources. If you go to a SCCA in Seattle or a Huntsman Cancer Institute in Salt Lake City, they have gigantic buildings dedicated to just oncology. So the resources that they have at these academic centers are a little more robust than the resources we have here. That being the big difference, I encourage everyone always, no matter where you are, to get a second opinion if that's something you desire. Sometimes there's clinical trials elsewhere that are offered that aren't offered at Bozeman Health, or just kind of confirming. I mean, oftentimes people go and get a second opinion and they say, yep, everything looks good. That's exactly what we would do. It's rare that sometimes they say, well, maybe we should do this instead. But in that event, it's good to have two brains on board. So I always do encourage people to go and do that. Like I said, we're affiliated with SCCA in Seattle. Huntsman Cancer Institute is also fairly close regionally in Salt Lake City. They're a fabulous group over there. Places like MD Anderson in Texas, Dana-Farber in Boston, Memorial Sloan Kettering in New York City. If you have family members in places like that, that might be a good thing to do. You can stay with family while having your second opinion visits, and that's always something you can look into as well. So choosing your healthcare team. So insurance coverage, of course, is its whole other beast. So we have an excellent social work team and financial case management who can help you guys navigate through insurance coverage and things like this. Logistics such as transportation, distance, and cost can also be addressed with social work and financial. It is absolutely critical to feel comfortable and confident with the people responsible for your treatment, and I can't stress that enough. So if there's any point where you feel, man, I don't feel comfortable with my oncologist, or I feel like I'm maybe not getting the attention that I need, there are absolutely no feelings involved if you want to either switch oncologists or switch to a different institution, because the goal is for you to feel very well taken care of and feel like all of your needs are being addressed. So never be afraid to bring that up if you run into that. So, as many of you know, there are many members of the healthcare team. We'll just start with the medical oncologist. So your medical oncologist is kind of like your quarterback. So they are the specialists who are trained in diagnosing and treating cancer and the use of chemotherapy and medical treatment for cancer. Your nurses, infusion nurses, nurse navigators, primary nurses, triage nurses, all play a role in kind of holding you guys up and keeping the boat afloat, essentially. So your infusion nurses specialize in giving the actual chemotherapy and immunotherapy. Your nurse navigators will help you, navigate through insurance, treatment, any kind of, ancillary questions and support system questions along the way. Nurse practitioners and physician's assistants, which you might hear at Bozeman Health referred to as APC, which stands for Advanced Practice Clinician. They're kind of like your running back. So they're like the oncologist second hand. So what usually happens is you'll see your oncologist who develops the plan, gets you ready to go for treatment, and then you'll see a nurse practitioner or a physician's assistant who kind of walks you through the treatment, checks your labs, manages your side effects, can prescribe medications to manage those side effects, and so on. When it comes time to check and see how the treatment's going with a scan, that is when your oncologist comes back in, evaluates, and then changes the plan or keeps the plan as course if things are going well, and the nurse practitioner kind of comes back in and walks you through the rest of it. So those are kind of your main medical team at the cancer center. Surgeons will perform biopsies. Surgical oncologists can also be involved. That is usually something that does not happen at Bozeman Health, and rather at Billings or in Kalispell or things like this. Pathologists are the ones who look at the biopsy and diagnose the tissue. They look at it under a microscope, check out the cells, and they're the ones who actually do the readouts for that, for those pathology reviews. So they look at the biopsies and they're able to see on a cellular level what kind of cancer it is. The radiologists are the ones who read the x-rays, ultrasounds, CAT scans, MRIs, and all of that. A radiologist is very different than a radiation oncologist. The radiation oncologist, we have one at Bozeman Health named Dr. Copeland, and they manage the treatment of cancer using radiation therapy. And the dosimetrist, radiation therapist, and medical physicist are all part of that radiation team. And ensuring that the doses for radiation are calculated safely and planned just for you. So your general practitioner or your primary care doc, they're important to have around. You know, of course, you get a cancer diagnosis, but other chronic health illnesses don't go away, or, you know, hypertension, diabetes, things like this. It's always good to keep your primary care doc on board and available even throughout this diagnosis. When it seems like you're always at the doctor's office seeing your oncologist, it is good to check in with your PCP and make sure that they're kept in the loop. Social workers, like I said, we have a really, really awesome group of social workers at the Cancer Center, and they do what seems like everything. They help you out emotionally, financially, and they're just a really fabulous service to have on board. So the pharmacists prepare your medications. We have an infusion. We have our own pharmacy team right in-house. So they will mix the drugs based on your body weight that day and send them out to you to get infusion. Psychiatrists and psychologists, they can help you kind of navigate the mental health side of this diagnosis. You know, I wish that just right off the bat, everyone could see a psychiatrist or a psychologist just to touch base, because this is something very different. It's traumatic to go through something like this. Social work does a really good job of counseling as well, so they're a good option for mental health, and this is for caregivers and patients alike. Registered dietitians, just helping you maintain a healthy diet. Appetite can sometimes go out the window when you're undergoing treatment, so it's always great to have a dietitian involved. Plastic surgeon for reconstruction, if that is part of your diagnosis. A rehab specialist or physical therapist to help increase your strength. That's another thing that would be awesome if everyone could go right off the bat to a physical therapist and keep that strength up, or even just learn a few exercises to do at home. That will really improve your outcomes as well. And then we have home health aid, hospice care providers, and clergy are available as well to help with medications and activities of daily living at home, and hospice to provide comfort measures. I would like to add to that list actually palliative care. We have a new palliative care doctor at Bozeman Health, and they specialize in symptom management. This is another thing that it's never too early to get palliative care involved. They can help manage pain, nausea, all these things, and they're really good people to have on the team as well. It seems like there's a lot of hands in the pot, and that was a very long list. You know, cancer is a very complex care, and the care is very individualized based on, you know, your diagnosis, what you need, your lifestyle. So there's a lot of complex care and multidisciplinary teams involved. Okay. Any questions so far? All right, we'll keep moving along. So preparing for your doctor's visit, always bring up—
Clarissa?
Yes.
There was one in the chat. It said, is there an oncology pharmacist who can answer questions about medications and side effects and interactions, etc.?
Yes, there is. So we have a group of 3 or 4 pharmacists right on campus. So they actually, their office is right next to the infusion center. So they're very easy to access, and they're a great resource to kind of go over those things with patients, and they're always happy to do so. All right, let me see if I can find the chat. For some reason I'm not, oh, here we go. Okay, great. All right, so preparing for the first doctor visit. Right now, because of the pandemic restrictions, there is one visitor allowed in person for these visits. On Zoom or on FaceTime, you can have as many as you want. The other day I had 8 members in a Zoom meeting, and it felt like a blast. It was like a party. So you could really, truly, with the telemedicine, it's nice because you can bring whoever you want as a second set of ears and eyes for these visits. Always, I encourage everyone to write down things. Oftentimes your provider will write things down for you and give you a packet to take home with your labs and information and things like this, but always kind of come with a pen and paper in case there's anything that stands out that you would like to write down and remember. Again, it's a lot of information all at once and it can be overwhelming. So I think it is good to record things and make sure that you remember the important points there. As far as recording the visits, as long as you ask your doctor first, if that's something you're interested in doing, that you would prefer to be home, play it back and write down the key points, certainly ask your doctor or nurse practitioner before doing that. And that's usually an okay thing to do. Medications. So typically the medical assistant will ask you all of your medications before you see a doctor or an APC. So any changes to medications, just let us know. The pharmacy does a really nice job of running your list of current medications and comparing them to your new medications, so we make sure that there are no interactions. Okay. Uh-oh. There we go. So again, things that you can do one day at a time, 1 month at a time, 1 cycle at a time. Just take it in chunks and try to make those decisions kind of as they come. Financial or insurance counselor is a great place to start. Social work can also help with that, like we talked about. Understanding that things can change. You can plan things out, and I always plan things out, and things always change, but we're all here for you, and we know that things don't always go as planned. So I think our role, and especially my role that I take very seriously, is try to help patients roll through the punches. And if there's something unexpected that comes our way, we definitely just kind of make our best effort to carry you through that and make sure that there's a contingency plan in place and that things run smoothly, and that any bumps in the road don't feel chaotic. So that's the goal. So if there's ever a time where you do feel like things are just getting too out of hand, let us know, and we want to set you up with resources to cope with that. Of course, the cancer support community is a really fabulous place. There's so many support groups, so many meetings on Zoom, exercise, things like this that are a really good thing to be a part of. Any questions?
Did you see the question, what is an APC?
Yes, so an APC is an advanced practice clinician. That I think is a regional term because I haven't heard it until I moved here to Bozeman. So that encompasses a nurse practitioner or a physician's assistant. And what those two roles are, it's essentially a step down from a doctor, a step above a nurse. So for myself, for example, I'm a nurse practitioner. I was a nurse for 7 years and then went to school to become a nurse practitioner, which is a master's prepared degree. And we're able to prescribe medication, diagnose, and treat symptoms. That's kind of our role. What the APCs can't do is diagnose cancers themselves, change treatment plans, and develop treatment plans. So that's kind of where your oncologist comes in. All right. Any other questions there? Okay. So we will move on to treatment options. So making a decision. Things to consider when you discuss with your doctor. Again, the oncologist will lay out several treatment options for you. having your goals in mind before you meet with the oncologist is a great thing to do. So when you hear certain treatment options, for example, if one is like, you know, these side effects are really, really rough and the treatment is for 2 months' time, and you say, well, rough side effects isn't something I was interested from the get-go, so no, you know, just kind of weeding out those options with your oncologist by having those goals in place would be a great place to start. Discussing side effects, reasons behind the treatment choice, and costs. Sometimes there are many options, sometimes overwhelmingly so many options for treatment. Sometimes there's only a few. And sometimes when you've already chosen a chemotherapy, there are new options that kind of crop up at any time. So this is an ever-changing field, and our oncologists are really good at kind of keeping abreast of that and letting patients know what options they have at what times. So guidelines and pathways. Clinical trials help develop these guidelines and pathways. So there's a focus on this evidence-based care. So the clinical trials will test what kind of diseases can get what kind of treatments and how well they work. And this is where all the percentages and prognosticators come in. So the guidelines are more of a resource for doctors and patients. Pathways are more of a formula made by, you know, kind of insurance and costs and what the holistic best case scenario is for people. You know, maybe the best treatment is $1 million a month. Well, that might not be best for most people. So they kind of checks and balances to see, you know, affordable, effective care. The guidelines are developed from that information gained from the clinical trials. So for example, the NCCN, or National Comprehensive Cancer Network, are guidelines that are widely recognized and used as the standard of care for clinical practice and policy. So everywhere in the US, oncologists are looking at the NCCN guidelines to guide care. This is why when you go and get a second opinion, oftentimes they say, yep, exactly, we think that Dr. So-and-so is doing the right thing, is because we are all using those same National Comprehensive Cancer Network guidelines. So we want to give everyone the best care based on their specific subtype of disease, gene profile, and stage of cancer. There are panels in place that do the checks and balances and make sure that the psychosocial, financial, all those other aspects of care are factored into these treatment decisions. Pathways also provide treatment recommendations for specific cancers and that are developed by expert panels and can be influenced by the cost of using a drug or treatment. So these, again, are a little more influenced by the insurance companies, for-profit companies, and certain oncology practices that reflect that kind of standard of care. So when your oncologist gives you some options for treatment moving forward, good questions to ask are, what are the goals here? So is the treatment curative or is it palliative? Palliative means kind of keeping things at bay or keeping things stable for as long as possible. Curative is trying to cure and have disease-free survival for, you know, 5+ years. So those are the two differences there. The recommendations for the treatment and how they work, you know, and asking how certain chemotherapies work and how certain immunotherapies work. Things are so different nowadays because before it was just chemotherapy, now it's immunotherapy, targeted therapy, monoclonal antibodies. So definitely, you know, ask about those mechanisms of action and your doctor will be happy to share that information with you. How long the treatment is, where it's given, is it intravenous, is it in a pill form, things like this. Combining all your appointments into one day. So if you're seeing social work and dietary, I always recommend that patients kind of, and the schedulers are great about that too, try to schedule that the day of your infusion so you don't always feel like you're at the hospital. Okay, so there are several types of treatment options, including chemotherapy, radiation, surgery, targeted therapy, and immunotherapy. Chemotherapy is it's historically been the mainstay of cancer treatment. So cancer is, you know, rapidly dividing cells, and what chemotherapy does is kill all rapidly dividing cells in sight, including that cancer. Rapidly dividing cells in your body that function normally include hair, skin, nails, your gut, things like that. So that's kind of where those side effects of the hair coming out or thinning, diarrhea, things like that, because all those rapidly dividing cells are affected by chemotherapy. It is systemic, meaning that it affects your whole body, and that's why some of those side effects can affect you from getting this chemotherapy. Radiation is delivered by high energy rays to a specific body area, and it is used to kill or damage cancer cells, sometimes alone, sometimes in conjunction with chemotherapy. There's external radiation, which is kind of a laser beam to a certain area, and there's internal, which is an implantation of seeds, ribbons, capsules, or liquid inside the body near the cancer's main site to target that area. Surgery is a common form of cancer treatment. So at diagnosis, to get a biopsy, to stage, to treat by just excising the cancer, to debulk by shrinking the cancer and then using chemotherapy to further shrink it, or reconstruction, for example, after a breast cancer, to reconstruct the breast to back to its normal look after getting treatment for that cancer in that area. Targeted therapy is the new hot off the press kind of therapy. It's more precise, and it attacks the cancer cells by targeting those very specific genes or proteins. These can be given intravenously or pill form or as an injection. Not all cancer types can be treated with targeted therapy because you'll have to express one of those mutations or targeted proteins that the drug targets. This is where things like genetic testing come in at diagnosis and things like that. So there is a very different side effect profile than chemotherapy because it acts differently. This definitely doesn't come without side effects. It's just kind of a different gamut. Immunotherapy is very similar to the targeted therapy. It kind of ramps up your immune system to identify, attack, and kill cancer cells. These are usually given intravenously. And again, very different side effect profile. Don't come without their own risks. But these are also fairly new to the game and have proven to be very effective. Palliative supportive care, it's never too early to involve palliative care. The goal here is really to improve the quality of life. They treat symptoms like pain, nausea, vomiting, anything related to comfort and quality, palliative care really specializes in. So you pick a plan, you get started, you have your first treatment, and now what? This is probably the hardest part of everything. So the anxiety surrounding not knowing what to expect for your first chemotherapy is probably the worst part of it. Once it's done, and once 5 days have gone by, you'll feel a lot better, and a lot of that stress will kind of go away. And that's when things kind of turn to, it just feels like you're more on a schedule and you can just start checking the boxes. So definitely take a survey and identify what kind of side effects you're having, what gets in the way of your daily life the most. If the nausea is very minimal and you take a pill and it goes away, great. Or if you have diarrhea that you can't leave the house, then that's something to consider too. Again, writing things down is a great way to kind of keep track and see what you encounter most often and what kind of gets in the way most often, and then hopefully we can mitigate that. Coping with the side effects. You may have side effects from your treatment. I think it's not a matter of if, it's a matter of when. Side effects it's rare that someone gets through chemotherapy without a single side effect. So to be completely realistic, you should kind of hunker down and expect to have, some fatigue, maybe a little nausea, maybe a little neuropathy, things like this. And just kind of be wary of those side effects and keep them in check and make sure that you're kind of writing things down, knowing what you're experiencing, checking the severity, how you're feeling, how they're impacting your life, and bringing them up to your doctor. Any questions on those? All right. So we will move on. So some important tools to help with common concerns. These are always great just to have on board for everyone at any time. So a living will, advance directive, power of attorney, financial power of attorney, all of these things can be, here we go, can be helpful just to have on file. Identifying if you want resuscitation, if anything were to happen or any heroic measures needed to be taken, have that documented in a DNR or a POLST form. Social work is excellent about helping out with these and helping you navigate through these as well. Nurse navigators are also helpful in completing these too. So when you come in, typically, you know, you meet with the oncologist first, and they should be bringing up these documents with you, and certainly take your time filling them out, speak with your family, and try to have those on file at some point. So for caregivers, this includes spouses, family, children, kind of identifying how much you have on your plate, how you can make room on your plate, and making sure you take care of yourself as well. Caregiver fatigue is definitely something that people experience, and it can be very stressful, overwhelming for family members and for patients alike to just, you know, kind of have this big task at hand, and having, you know, all the normal life, and now we have a pandemic and all these things going on. So there is a lot of stressors. So we're here to help you navigate through that and make sure that caregiver fatigue doesn't get too bad. Definitely think through the steps, plan, use your medical team as a resource. You know, we're here to help you. And if, you know, for childcare, if it's difficult to get to infusion because you can't find childcare, for example, let us know and we can help you work around that. So for the visits, like I said, in this wacky time, unfortunately, we can only have one person in the visit in person, but if you're on Zoom, anyone is welcome to come, FaceTime, anyone is welcome to come, etc. So the more eyes and ears you have, the better. I think sometimes as the patient, it's good to just be present, mindful, and you know, there for the visit. Sometimes family or friends or spouse can just write things down and kind of be your scribe almost, and keep track of everything, keep track of the medications and changes in treatment, and just writing all those things down. Everyone handles this differently. So I think, you know, you don't necessarily have to compare notes after each appointment, really whatever works for you. So taking the next steps, be selective as to where you find your information. Google is not your friend. Always ask us, we're always available. During business hours, there's nurses available on the phone. And after business hours, there's always an oncologist on call. So if there are any questions, emergencies, new symptoms that arise, any questions you have, just reach out to us, and we want to hear from you, and we're always here for you. So the cancer support community resources are also a really great resource. So the helpline with the number listed there can be accessed Monday through Friday, 9 a.m. to 9 p.m. Eastern time. The cancer support community here in Montana is also a great resource, so calling them can be a good place to start as well. So this Cancer Experience Registry, it collects research to survey and identify and understand emotional and social needs unique to the cancer experience and to the patient. So this is kind of a cool way to contribute to research in the cancer field. The registry timeline has grown exponentially over the years to include a lot of different disease sites. And this is kind of a great resource to reach out to and not only be a part of the research, but use the information that they've gathered thus far to better inform your experience. And the cancer support community, again, is just a really fabulous resource, including social and emotional support. The website to join the grassroots movement would be listed at the bottom. And I'm sure you can get more information at the cancer support community right here in town. mylifeline.org is a really neat website that you can use. You can update your family and friends, let them know how you're doing via a blog. You can look at other people's blogs around the country, around the world, to see how their journey is going, and if they're on the same treatment as you. There's these open forums that are really, really helpful for patients to learn more about treatment, side effects, and just general experiences. If people want to do meal trains for you or ride setups, there's a calendar where they can coordinate that information as well, and it's all private. So that's another great resource for patients and families.